Imagine landing in Dubai this morning and walking out this evening with a fixed full arch smile.
We have turned that promise into a reality.
Our guests are Dr. Costa and Dr. Petros.
I met a weird guy, gray-haired guy, who was telling me that he can place teeth on top of implants immediately.
So the question is, what makes it possible? We are adapting the implants to the available bone rather than creating bone for the implants.
And depending on the bone quality, sometimes we're using some specialized drills that you don't drill clockwise, but you are drilling anti-clockwise.
So you're not fixing everyone in the same box.
Exactly. It's not one treatment for all. And we can do a dry run. We call it a dry run. That is model surgery on the 3D printed model of that patient. They are very relaxed. And usually at the end of the treatment, they don't even remember anything. I think the next frontier is robotic surgery.
You cannot stay behind. You need to take advantage of any technology which is resurfacing.
A patient should not die with their teeth sitting in a glass of water.
Who is shaping the future of dentistry? Who should we invite next? Just drop their name in the comment below.
Imagine landing in Dubai this morning and walking out this evening with a fixed full arch smile. Today at Next Dental, we sit down with the dentists who turned that promise into clinical procedure routine. Welcome, listener, to Next Dental podcast. This is the new episode where our guests are Dr. Costa.
Dr. Costa, oral and maxillofacial surgeon specializing in same-day, full arch and zygomatic cases, 50,000 plus implant placements. Graduated with distinction from Wits University, fellowship in maxillofacial and oral surgery, ICOI diplomate, international speaker.
And Dr. Petros.
Dr. Petros, specialist, prosthodontist, and co-architect of SameDay's immediate load full arch protocol. Top of his class at Semmelweis, summa cum laude. Completed a 3-year prosthodontics program at Tufts University. Clinical assistant professor at Boston University and adjunct faculty at Tufts. Leads prosthetic planning and same-day delivery. Together, co-founders of SameDay Dental Clinic, Dubai, and co-directors of the Brånemark Osseointegration Center and ZAGA Center Dubai, delivering next-day full-arch treatment via an integrated digital workflow from CBCT to in-house design and lab.
Hi, Antonello.
How are you guys?
No, we are very well, and thank you for inviting us here. And yes, as you said, we have turned that promise into a reality.
Yes.
And it's something that we do basically on a daily basis, and we've been doing it together since 1998.
1998. That was
Yes.
the first question. When everything started?
Well, I started this in 1994. The very first case I did was back in South Africa, believe it or not, in 1994, and things went very well. And then when I teamed up with Petros in 1998, we basically have been doing it ever since on a very predictable and successful manner.
It was 1998, just about when I finished my postgraduate studies at Tufts University in Boston, United States. And I met a weird guy, gray-haired guy, who was telling me that he can place teeth on top of implants immediately. But back in 1998, nobody was doing that. I said to him, Costa, how is that possible? And he said to me, I'm doing that already for the past 7 years.
Past 7 years.
Yeah.
Yeah. And in our opinion, it's definitely the correct way to do it. And with the patients in today's day and age who have either a busy professional or a busy social lifestyle, they actually expect that. Patients today expect to have, for example, some teeth removed or all their teeth removed, have the implants and the teeth in the same day. Of course, I mean, it's 2025 now.
It's possible.
It's
so
possible
we want
to do it.
Yeah.
Of course, not everybody does it, but if you have the surgical skill, the surgical training, and the prosthodontic expertise, and if you have the right team, remember we said we teamed up.
Yeah.
It's all about a team approach. If you have the right team of a maxillofacial surgeon, a prosthodontist, a dental laboratory, which is crucial to the success of this treatment. You have to have a dental laboratory under the same roof, all under one roof. And of course, all the digital technology that goes with it, both in the dental laboratory as well as the diagnostic digital technology, the 3D scans and the CAD cams and the milling and the printing. You need to have all that under one roof in order to make it happen.
Yeah. Okay. So you started, even though the intraoral scanning was not out there at the moment. So you started with the silicone.
We started with the analog, old-fashioned silicone and analog and 2D X-rays.
Of course, things were not the same almost 30 years ago.
Yeah.
They were completely different. At that time, we were not doing 3D scans for our patients, CBCTs. It was just a panoramic X-ray.
It was a 2D X-ray, basically.
2D X. And what was the tech that changed drastically, let's say, the workflow from 30 years ago? I mean, you started in doing this same day in
94 I started, and together we started in 1998.
Okay, and so far, what was the tech that drastically improved?
I think the 3D scans, the 3D diagnostic imaging, the CAT scans.
It was a gradual process. Until 2006, we were providing temporary teeth same day, but we were waiting for temporary teeth for about 2 months, and afterwards we were providing the permanent teeth. But after 2006, we were providing temporary teeth same day, but the permanents were made for the patient ready in about 5 days, maximum 1 week. Nowadays, we do it even faster, the permanent teeth. For a single crown, we are providing the permanent tooth same day within 4 to 5 hours. And for a full mouth, within 2 or 3 days, the permanent teeth are ready.
Yes, because we are talking in the same day for the temporary.
If it is a full arch.
Full arch,
yeah.
Yes.
If it is a single crown, same day the permanent.
Which is good because you are not without your teeth.
You are never without.
You're never without.
Without a tooth or all your teeth. So never mind, irrespective of how many teeth will be removed, you will always have teeth on the same day.
That's really enthusiastic for people who are flying, and I would like I imagine myself, okay, I'm flying to Dubai. I'd like now to see what is the workflow, where I'm going to. I think on the website you promise extractions and implants and all the related procedure for in the same day. So with the first consultation on the online, is that correct?
Yeah, the idea is that you can make an online inquiry or you can give us a phone call and our patient coordinator will get in contact with you. We'll ask you for certain X-rays that you can provide us through an email, for example, and we can make a Zoom consultation with you and implement a treatment plan for you, a potential treatment plan for you.
Once I accept it?
Once you accept that, then you can fly over to Dubai.
Okay.
And theoretically, you could come directly to our clinic or you go to your hotel where we can send our courtesy car to collect you.
Courtesy car, guys. That's really good. Yeah.
Yeah, we're in Dubai.
Yeah.
So our courtesy car will come and collect you and bring you to our clinic to have the actual consultation.
And even the treatment, if you decide to have the treatment.
Yeah, okay. I'm coming from
go.
Italy. I want to go and go back.
So you can have your consultation, any additional scans, X-rays, and we can even do the treatment. And you will get your teeth on the same day. That's a promise we make, is a promise we keep. You will get your teeth on the same day.
Okay, this is from the patient side. Now let's talk about the technical and clinical side, because not everyone can deliver this kind of service. So what is the structure that can give that? What is the structure to have that can give you the possibility to?
So the question is, what makes it possible?
Yeah, what makes that possible?
You need, first of all, appropriately trained, specialized dentists, oral maxillofacial surgeons, and prosthodontists who have been trained to do this technique, who have the skill set to do it, who have the expertise to do it, and of course the experience to do it. So you can't expect someone that just came out of dental school a few months ago to do it. You need somebody that's done postgraduate training and specific training for this type of treatment.
Yeah.
So definitely it's possible, but with the correct continuing education, with the correct training. It's all about training. The next thing you need is the infrastructure. Petro?
Yes, our clinic, it's like a small hospital which provides implants and teeth in a day. That means that there is 2 very well-equipped surgical rooms where Costa is doing his surgery. He's extracting teeth, and on the same day, he's placing the implants. And we have a dental laboratory inside our clinic. Nowadays, this laboratory is fully digital. In the old days, it was not digital, but this is how you evolve slowly. So today, it's fully digital. And at the end of the surgery, we're taking an impression of our implants. And the technician, the in-house technician, fabricates, actually we have three technicians, fabricate the temporary teeth in a matter of a few hours.
Usually printed.
Usually printed.
Printing teeth,
Yeah.
yes.
Okay.
So
printing.
those are placed inside the patient's mouth, are tested and evaluated by myself and the other prosthodontist. We are a team of prosthodontists in our clinic. And once we are satisfied and the patient is satisfied from a functional but aesthetical point of view as well, then we can proceed for the fabrication of the permanent teeth.
And is the patient waiting here for the permanent teeth? How do they approach this?
The idea is that yes, very nice question. The idea is that just after the surgery, we have a recovery room. So the patient is waiting for those 2-3 hours inside the waiting room, recovery room. We're placing the permanent teeth, evaluate the permanent teeth on the spot, and the patient can wait in Dubai for 2 or 3 days maximum for the fabrication of the permanent teeth. So basically, within 5 working days, you can have everything ready if we are talking for a full mouth rehabilitation. Now, if we are talking for a single crown, for a single tooth, then you can fly in the morning in Dubai and you can fly away from Dubai the same day.
We have done that a number of times. On this very same day, the patient flies in, has 1 and even 2. The last case we did was 2 implants. And the patient flew back the very same day in the afternoon, came early in the morning and flew back home in the afternoon with 2 implants and 2 teeth, permanent teeth.
It's very important to specify here that our permanent teeth, they are not acrylic teeth, because many clinics are promising permanent teeth, which at the end of the day ended up being acrylic teeth. We're talking about zirconia teeth, and this is very important. So nowadays, we have the technology to finalize our cases with zirconia teeth with the help of fast-sintering furnaces within a matter of a few hours. Usually, in order to sinter the zirconia teeth, you need more than 12 hours for big cases. But with the help of fast-sintering furnaces, you can finalize those in a few hours.
And this is something that I like. If I want to see myself in this situation, I like the fact that I can fly in the morning and I can walk out to the clinic. with a smile, but I will not go out of Dubai. I will enjoy the Dubai.
Yes, exactly. So what we tell our big cases, like the full arch or the full mouth, you have your surgery done today.
Yeah.
You have your temporary teeth placed today.
Yeah.
You can go away for 3 to 5 days. Go and do some touring, go and have a holiday, do whatever you want to do in the area, and come back. We'll tell you the day and the time, for example, in 5 days, and we'll put your permanent teeth. So you don't have to stay in Dubai, but you can choose to stay in the UAE. And we have some patients from surrounding GCC countries. Sometimes they fly back to Saudi or Qatar or one of the other countries.
It's their choice, yes.
It's their choice. And then they come back after 5 days and we place the teeth.
Yeah, of course. And regarding the testing, did you started in Greece with this procedure and this kind of workflow?
In South Africa originally, by myself and some other colleagues in South Africa, and with Petros in Greece.
I'm younger.
So SameDay clinic started there.
Yes.
And
the SameDay concept started there. And then we came here in 2011.
In Dubai Healthcare City. We stayed there for 3 years. And then we moved in Jumeirah Road, Beach Road, as we grew. And we needed more people.
We needed more people and more space and better parking, of course. And we have our own villa, self-contained villa, which is purpose-built for our SameDay clinic with all its infrastructure and, of course, the convenience of parking for the patients who choose to drive to us. And those, as Petros said, that want our chauffeur drive courtesy car to collect and deliver, we do that routinely.
What makes you different from the others? So the concept, we understood the concept, but there is something that you do that others are not doing.
I think it all boils down to the surgical skill and expertise that you may have in order to do this treatment. And of course, I don't believe I'm the only one, but I don't think everybody has the appropriate and necessary surgical skill set to do same-day extractions, implants, and teeth.
Usually when you are placing an implant inside the bone, that implant is not one with the bone immediately. It needs 2 months for the implant to become one with the bone, and this is called osseointegration.
Osseointegration. Yeah.
For osseointegration to happen, that implant should stay still. It should not move. If it moves more than 150 microns, it will never osseointegrate. That's why most of the dentists, they are placing the implants, they're waiting for 2 months without teeth because they're afraid that if the patient bites onto the implant with the tooth, it will move and it will never osseointegrate. That's why they're waiting without teeth for 2 months. And 2 months later, they load the implants with teeth. What we do, it's called immediate loading. We are loading the implants immediately with teeth. How are we able to do that? There is a lot of scientific research which says that if an implant at the time of the placement, it's placed with very high torque, and we can measure the torque, it means that because it is so highly, it's placed with so high stability, it's difficult to move. And that's why you can load it immediately with teeth. So this is what Costa does. He's specializing in placing implants with very high torque inside the bone.
So when I place the implant in the bone, it's very stable.
Yeah.
It's difficult to move that implant.
If there is the bone.
If there is the bone.
Then we have a solution also if there isn't.
We certainly have a solution which we can discuss if there isn't enough bone. But if there is enough bone, we place the implant in the jawbone, either upper or lower, and I place it with good stability. So the question is, why can't other people place it with good stability? Well, some can, but the idea is to drill the hole in the bone in a very precise manner so that when you put your implant in, there is maximum bone-to-implant contact. And there is this very intimate adaptation of the bone to the implant, causing the implant to be fixated very nicely and not move.
Yeah, so the secret is
Stability.
stability
Which
from
we-
the first.
Exactly, which in dental terms is called insertion-torque value. You want a high insertion-torque value.
And depending on the bone quality, sometimes we're using some specialized drills that you don't drill clockwise, but you are drilling anti-clockwise. So instead of drilling out all the bone from inside the osteotomy, you compress all those bone particles inside the osteotomy. So you increase the mineral density of your osteotomy and place the implants with higher torque.
So with this amazing technology, it's called Versa technology, you can make bone harder. Because some patients, especially elderly ladies, women, they have soft bone. They call it osteoporosis or osteopenia. And in those cases, you need to use these drills that Petros is talking about to increase the density of the bone. So there is technology. Technology is helping us both in the dental laboratory,
Yes,
in the
yeah.
imaging, the scanning, and in the bone drilling. So all these things are optimizing the treatment in order to give us an accelerated, the word is accelerated treatment protocol, and finish the treatment either on the same day, if it's 1 or 2 teeth, or in the same week with permanent teeth.
The other thing that we're doing is, other than making specialized osteotomies, we're using something called specialty or site-specific implants. Those are implants which are designed for a purpose. They are designed for a specific area. The idea is to customize your implant to be fitted to native bone, not for you to have to go through complicated grafting procedures, which have a lot of morbidity, pain, complications. The idea is to utilize the native bone and take advantage of it and place the implants immediately without having to go through those difficult grafting procedures, which take time. You need sometimes to wait 9 to 6 months.
And sometimes even a year.
Even
So-
a year.
So it's
Yeah.
we don't like to do that unless it's absolutely essential, and it maybe once every few years we have to do a case like that. Maybe once every 5 years, if that.
Because you're adapting.
We are adapting the implants to the available bone rather than creating bone for the implants.
Yeah.
So we have specialized drilling technique, specialty implants to take advantage of those osteotomies. But sometimes, even though that we do all those techniques, bone still is not enough at the regular areas where usually you're finding bone. And this is where the expertise of Costa are very handy, because he's able to find bone which are remotely placed.
So what we do in those cases, patients that do not have enough bone,
Yeah, because
enough
okay, so
jawbone.
the bone play a crucial role, of course. And
Absolutely.
The stability. If there is, it's good. If there is, but it's not hard, you can increase the density.
Exactly.
But what if there isn't?
What if there is no bone at
Yeah.
all? And unfortunately, there are those cases. We say that the bone is extremely atrophic, the atrophic jaw. And what we do in those cases, from our 3D scanning, we use the DICOM files, convert them to STL files in our laboratory, in-house laboratory, and within 3 to 4 hours, our laboratory prints a 3D biomodel of that particular patient's skull, facial part of the skull, so that we can see exactly where the bone is missing, and we can identify remote areas like the zygomas, the cheekbones, or the pterygoid bones, which are located behind the last teeth in the upper jaw. And we can do a dry run. We call it a dry run. That is model surgery on the 3D printed model of that patient. We can drill and see where the best position is to place these special implants, zygomatic implants or pterygoid implants, in order to take advantage of remote skeletal sites, which means sites not exactly in the jawbone, but slightly remote to the jawbone. And we can use what we call the ZAGA concept, which means zygoma anatomy guided approach, to even optimize the result of these severely atrophic case treatments even more. And of course, always giving them teeth on the same day.
Because for the listeners, SameDay Dental Clinic is the first certified ZAGA center in UAE. Yes.
In the UAE and basically in the whole GCC area.
Okay.
We are the first and the only one at the moment.
And the only one at the moment. And what the ZAGA concept, what is this about?
Okay, so the ZAGA concept was developed by a famous and genius specialist dental surgeon by the name of Carlos Aparicio in Spain. And what he worked out is that not all zygomas are equal. Some patients have big zygomas, some patients have smaller zygomas, and even the one zygoma on the one side and the zygoma of the other side in 58% of patients is not the same. And also depending on the degree of atrophy, how little bone you have, and the anatomy of the zygoma, the treatment, the surgical technique of placing the zygomatic implant changes. And it is a patient-specific surgical treatment for placing these zygomatic implants.
So you're not fixing everyone in the same box.
Exactly. It's not one treatment for all. It's not one technique for all. It's patient-specific technique, and that decreases the complication rate significantly and increases to a great degree the success of this treatment. And we give Dr. Carlos Aparicio a lot of credit for working out the ZAGA concept. And yes, we do apply it on all these cases.
You do apply it on all these cases?
On all these zygomatic cases.
Zygomatic cases.
Antonello, another title that we hold, it's the so-called Brånemark Osseointegration Center, Dubai.
Osseointegration.
You know, the father of dental implantology, it was Professor Brånemark from Sweden. So there is a network of clinics by the name Brånemark Osseointegration Centers, and we are the Osseointegration Center, Brånemark Osseointegration Center of Dubai.
Of Dubai, because you're giving courses also.
Yes, we are, both of us, we are national and international lecturers, traveling a lot. But we were very fortunate to be able to have met Professor Brånemark. Unfortunately, he passed away.
12.
We met him in 12, but he passed away in 13, 14. And we're extremely lucky to be able to meet him in Göteborg, Sweden. And we follow his lead. His motto was treat more patients with less surgery. So he wanted to avoid complicated surgeries and treat as many patients as possible with the less amount of trouble.
Yeah, he said his take-home message was lesser surgery to treat more patients. So he was, although he did a lot of bone grafting and big bone grafting procedures from the hip and from other parts of the body, he was an orthopedic surgeon. At the end, he decided that the best is to use what he called Mother Nature's bone, in other words, native bone in remote areas. And in actual fact, he was the first guy to describe the zygomatic implants. Carlos Aparicio just modified and optimized the technique with the ZAGA concept. Another very interesting thing, and it always stays in my mind, that Professor P.I. Brånemark said, he said we should be treating these patients because a patient should not die with their teeth sitting in a glass of water. It's basically a denture sits in a glass of water. So he said patients should not die with their teeth sitting in a glass of water. They should die with their teeth in the mouth.
Yeah, I like that.
Nowadays, we have the surgical knowledge and the technology literally for every patient for that to be achieved within a day.
We're talking about using the technology available today at 100%.
Exactly.
Yeah, we want to achieve the best result using the technology that we have at our disposal. And regarding the quote on your profile, Emerson quote said that leave a trail rather than choose one. So from the beginning of starting this concept and the clinic, what was the biggest risk of starting this?
Well, first of all, yes, I do believe in leaving a trail instead of following one, because I've always believed that if you want to succeed, you should do something different. You should take a different route to achieve a better result. So you don't want to only take a different route, a different trail. You want to take a different trail to achieve a better result and do it better. Otherwise, you're just one of the crowd. If that's what one wants, it's okay. It's not wrong. But if you want to make a difference to your patients, to society, to people, then you probably need to choose a different trail rather than follow one. And the risk in doing that is that it may not work out. But because we had done this already, well, in South Africa, where I give credit to other people that pushed me into that trail, a prosthodontist in South Africa by the name of Dr. Andrew Ackerman in Johannesburg. He was a big driving force for me. We had worked out the way and the trail. We worked out the trail. So it wasn't really a risk. When we came to Dubai, it was no longer a risk.
It was a risk over there.
There it was a risk.
Yeah.
But by the time we got to Dubai, there was good scientific literature and scientific research to support what we're doing. So what we did was scientifically evidence-based.
For Dr. Petros instead, Beverly Sears said you are doomed if you don't try. So what was the mindset that shaped the foundation of this concept, this clinic?
Again, we wanted to bring in Dubai something different, because in 2010 we took the airplane with Costa and we came here, and we made the research to find out who else was doing same-day teeth. Actually, nobody was doing same-day teeth. And that was the reason why we came here, to provide this service in a place that nobody was doing that, or nobody was even claiming doing that, because nowadays many people are claiming that they can do it, but in reality, they don't do it.
Yeah, because you're focusing on it like it's a routine. And do you see the difference of the location? So is Dubai working more than others because of maybe there are a lot of people flying in and out, or how do you see the role of the city?
Dubai, it's a hub. It's so easy to access Dubai. There are many tourists coming here, but many people, they want to travel to Dubai to do for medical tourism. So yes, definitely Dubai is the place to be in if you want to do something similar. So that was one of the motivations for us coming here.
Yes, Dubai definitely has a lot to offer. Being a hub, like Petros said, it's very convenient for people to fly here from almost anywhere in the world. On the other hand, it's not the most densely populated city in the world, or the UAE is not. So, you know, there are countries that have a far bigger population and they probably do more implants. But Dubai is nice with everything that goes with it. And it's certainly a convenient, pleasant place to come and have this type of treatment.
Yeah, especially with this type of treatment that it's for flying people. So that's
It's for people that are busy.
they are busy. Yeah.
Yeah.
It's
And-
not only for flying, yeah, of course, but even for people that
And certainly we are grateful to the local authorities that they made it possible for us to come here. They have strict procedures, how to get licensed to practice here, and strict regulations, but everything is possible, and that's very important.
Okay, now let's say I want to come to Dubai to have this kind of a treatment because I'm really scared. So I'm happy as soon as I finish. So, but still I'm scared because if I see, okay, now I want to do the treatment, but it takes me a lot of time. For me, in the mindset, I will never go because it takes too long. But this situation, it's good for me that I have a phobia for that. And but still I need something that convinced me to come. So how do you treat this kind of patient that they're scared?
Okay, so we have three groups of patients. We have patients that are not really scared, and we treat those patients with normal dental local anesthesia, like a dentist. And then we have patients that say, no, I'm a bit scared. Then we treat those patients with sedation and local anesthetic in our office, in our clinic.
Here.
What does sedation mean? It means that you give the patient usually a tablet, which is a sedative, and it makes the patient very relaxed.
But awake.
Semi-awake.
Semi-awake.
Semi-awake, but conscious. In other words,
Conscious, yeah.
they breathe by themselves. They can cough. You can tell them, do this or do that, and they will respond to you. But they are very relaxed. And usually at the end of the treatment, they don't even remember anything.
Okay.
So that's called sedation. That's conscious, which means they are conscious oral sedation. And we do sort of 90% of our big cases that way. With
90%.
with conscious oral sedation. Then you get other patients that say, no, I don't even want to be a little bit awake. I want to be totally sleeping.
So listen if it is your case.
So if that's your case, then across the road from our clinic, we are very fortunate that we have an excellent private hospital. It's the Dubai London Hospital. And we take our patients exactly across the road, which is
Okay.
convenient for us and for the patient. And we do the procedure there under full general anesthetic. And they either go home the same day in the evening, or if it is really a big procedure and they don't want to go home because they have flown in and they don't have people to look after them at wherever they are in the hotel, then they sleep over in the hospital for one night, and then the next day they go home with their teeth.
That sounds amazing. There is a solution for everybody.
So there's a solution for every type of dental patient.
Yeah, that's really a good service from A to the end. Regarding the tech that we were talking about, the structure, the infrastructure that you need inside the clinic, that also means inside the lab, team and the clinic and the lab. The intraoral scanning played a crucial role of improving the timing of this communication as well. But inside of it, inside the intraoral scanning, do you use any kind of technology for taking the scanning, like photogrammetry or
Yeah, there are different kinds of photogrammetry. They first appeared something like 10 years ago, but not many people were using that. Nowadays, and more specifically the past year, 8 months, there's something called intraoral photogrammetry.
Yeah.
It's a technique that we are using an intraoral scanner to take implant impression using the photogrammetry technique, which has a lot of advantages. The most important is that we have an accurate impression, an accurate scan of the 3D position of the implants into space, which is of paramount importance for us to fabricate teeth which have passive fit on top of the implants. If the prosthesis doesn't fit well onto the implants, it will fail. So it's so important to have an accurate scan, and the technique of photogrammetry, it's a warranty for us.
Okay, we understood the whole workflow from flying in and flying out from this experience. What do you think now will be the next shift change in digital dentistry?
I think the next frontier is robotic surgery.
Surgery.
Yes. So based on the treatment plan that we make on our digital diagnostic images, and so we plan the implants on the scan, and then the robot will place the implants exactly where we planned them. But of course, the robot should always be guided and also be able to be intervened by the surgeon. Because at the end of the day, the responsibility is not on the robot. It's on the human. I think that's where it's going to go. What about your side, Petro?
Yes, many people are talking about the digital smile design. Yes, it's very useful, but if you don't have the concept as a dentist to put down the basics, you cannot only do it with digital. You need to have, you need to know both analog and digital. And this is a very soft line that nowadays the universities, they have to go through. And I know that because I'm teaching in Boston University and at Tufts University in Boston, Massachusetts. All universities gradually, they're going towards the digital part, but they realize that it's important for the students also to know the analog part.
Yeah. Education plays a crucial role.
You need to know both in order to optimize results. You cannot know just one. And I see the same at the field of the dental technicians. In the past, you had the dental technician who was an artist. He was playing with the porcelain, placing the porcelain layer by layer. Nowadays, you don't see that, or you don't see it as much.
Not as much, just someone is...
You have young boys and girls which are experts in designing. So they have two mouses and one screen, and they're designing.
Two screens.
Yeah. I mean, this is different. But you cannot just do that. I mean, you need to know everything. You need to combine knowledge, analog and digital.
Of course, that also applies to robotic surgery.
Yeah.
You know, if the robot does something you don't like because you didn't expect to find soft bone in some area, you need to be able to redirect the surgical pathway.
We're talking about robotic and the smile design without mentioning AI, but might be integrated
into that. AI will be part of that.
You cannot stay behind.
Yeah.
You need to take advantage of any technology which is resurfacing. But you need to combine everything. You need to combine everything if you're going to be on the top front.
Well, I think that with this, we covered most of the topic that were interesting for all the listeners out there. So I would like to thank Dr. Petro and Dr. Costa for being here and sharing all your inputs.
We thank you, Antonello.
Thank you, Antonello, so much for your time.
It was very interesting discussing this with you, and we believe the audience will find it interesting as well.
Thank you, Remedico, for sponsoring this podcast, and I'll see you in the next episode.
Want to use AI in your clinic? Try Remedico EMR, sponsor of this episode. They are pioneering AI for dental clinics. Go to remedico.app and request a free demo now. Remedico, software for modern dental clinics powered by AI. Hey, and don't miss next episode. Search Next Dental one word, no spaces on all major podcast platforms, and click subscribe.